Next guest, who has become a fan favorite, if you will, cardiologist with SLU Care and SSM St. Louis University Hospital. He is known as Dr. Michael Lim, and he is a cardiologist to the stars. Dr. Michael Lim, welcome back, my friend.
Good morning.
Good morning.
Let's talk about this new study that was put out this week. Bad news. We are dying sooner and sicker.
Bad news.
That's not good.
It's kind of a depressing story.
It's alarming.
They sort of went into three different things. One, definitely the American folks are working longer, so retirement age is creeping up. When you work longer, you have fewer years of retirement, so
Right.
Is there still something you can enjoy? And so they just juxtapose that with the fact that actually people are less healthy during their retirement and older years. And the death rate is climbing a little bit in this country for the first time in many years. So that's the bad news.
Yeah. If you dive a little deeper into this study's new, but over the last couple of years, I've read stories where rural America is being decimated by women. White women are living shorter, not as long, but less. The health, the safety of rural America and white women is plummeting.
I think the assumption that we can live to whatever the average lifespan is, the assumption that we have many years in front of us if we retire at whatever age we want to retire at, you can't take that for granted. I think that there does have to be some work and some effort that's put into it. The same kind of thing is if you save for retirement. You want to save for retirement so you have something to be able to use when you retire. I think you want to save and work on yourself so that you can enjoy your retirement. Now, the current concept of how the workforce is used right now doesn't help much because obviously individual people have been stretched pretty thin, and I think people are working a lot harder and are a lot more stressed now than they were at least a decade or two ago in the workforce, and that's something an individual person necessarily can't help as much. But I think that adds to the impetus for we gotta really work on our health. We gotta eat better. We have to exercise more. We have to watch our weight. We can't take all these shortcuts of these fast foods, skipping meals, eating bad things,
Right.
And think that when I retire I'm gonna live a healthy life.
That's what's really alarming. I was looking at this article, and the quality of life for people who are in their mid-50s into their 60s is, for a group of people, quite poor.
Yes. And so we're definitely not talking about everybody, but I think
Right.
that when we talk about large population studies, I think we should pay attention to it as, well, it potentially could affect me. This could potentially be me. And so issues like debilitating back pain and back discomfort when you work so hard and you didn't necessarily do as good a job as you could at taking care of your back. Now you're completely debilitated when you're retired and you can't do anything. That's not a health concern that's going to potentially shorten your life, but it's certainly not going to make it very good.
What's interesting, I'll go back to this rural versus city deal. You can eat healthier. There are choices that one has to make, right? You drive by a fast food restaurant, or you go into a place to buy some fresh fruit or some fresh vegetables. But in some communities, inner city, rural, you have the option of a dollar store or a gas station or nothing.
Or nothing. There's a ton of areas that get labeled as food deserts.
Yeah.
And some of those are surprisingly in the middle of very populated areas.
Yeah.
And we have some of them in downtown St. Louis.
Yeah.
There's no doubt.
Yeah.
Rural America, same kind of thing. The dollar doesn't stretch very far, and so people and families are stretched and strapped, and they're trying to make do. There's no quick and easy solution to any of this.
Yeah.
But
when somebody pointed out to me that it's cheap to buy really bad carbs, right? Sugar, carbs, that's cheap. But to get a steak, to get protein, to get chicken, that costs a little more money. And the stores don't make as much money on the stuff that sort of goes bad. So that's the economics of it all.
It is.
And also the education of people who live in the urban or the rural areas.
Right.
Educating people that you can get some food in grocery stores, the exterior of the aisles of the grocery store, and still not spend as much money.
I think it's a matter of priorities, I would guess. Yes, the dollar doesn't stretch as far, but where are you going to stretch it to, and what are you going to spend it on? And investing in yourself.
Yeah.
And then we've pushed that all along, McGraw and Kelly, in the concept that I think people do have the ability to invest in themselves and invest in their own health, and I encourage them to try to do so.
That's Dr. Michael Lim, looking good with your bow tie.
Thank you.
I like you in the bow tie.
Thank you.
I do too.
Does your new wife like you in the bow tie?
She bought this one for me, so I
She
think
has good
that's a
Classy
testament
woman.
for that.
Classy woman. Cardiologist with Slew Care and SSM St. Louis University Hospital. Doctor, thanks for checking in.